Welcome to Medical Associates Health Check. My name is Dr. Laisha Selvaraja. I am the Clinical and HR Administrator for Medical Associates Hospital, and my co-host.
I am Dr. Christopher Bristow. I am the founder of the Concierge Medical Clinic and a specialist physician in internal medicine.
So, Chris, last time we were talking about colorectal cancers, the medical treatment, how to screen for it, a diagnosis, and how doctors in our medical team follow up with the patient.
Right.
But today we have Dr. Yardish Singh. Welcome, Dr. Singh.
Thank you very much.
He is a renowned surgeon in Trinidad and Tobago, but I think you might be able to introduce him a bit better than me.
I think Dr. Singh is more like a legend, you know. Dr. Singh actually is a big mentor in the surgical sphere, and he'd have taught many surgeons,
Even
junior
young
doctors as
yeah.
well. And under his belt, he has covered probably more than 1,000 laparoscopic surgeries.
Yeah.
So, I mean, we have some good surgical credibility here for the information that will be shared.
Yes, for sure.
And we look forward to hearing from you. So welcome, Dr. Singh.
Thank you very much.
All right.
So, Dr. Singh, you could tell us what colorectal cancer means to you as a surgeon or in the surgical specialty.
Okay, so I mean, colon cancer or colorectal cancer, it's a very, very common cancer. It's probably one of the most common cancers.
Yeah.
And that's for both men and women.
And it's both men and women.
Yeah.
Yes.
Is it an equal split when you see the patients, or is there a predominance within males versus females? Or?
I think it's probably about an equal split.
Yeah.
But what is alarming today is that we're seeing colon cancers at a very young age.
Yes, we touched on that last week, so maybe you could elaborate what you see.
Yeah, I mean, probably about 20 years ago when I was training, you know, you'll see colon cancer in the above 50 age group.
Yeah.
But today, if a patient walks in and they're in the 30s, they might have colon cancer.
Yeah. So we actually shared this as an example in the last episode.
For sure.
Where we actually had two patients who were around 28 years old.
Correct.
Having
I've
colon
actually
cancer.
operated on a patient who was 13 years old.
Wow.
13?
Yeah.
1-3?
Yeah.
That's
Wow.
incredible. So, you know, like when we watch the team, and going back to the team for surgeons and doctors in general, the surgeon is almost like revered, you know, as the god in the room to try and fix this problem.
I mean, it's not a one-man show.
Yeah.
And every specialty has a role. And in colon cancer especially, the oncologist, the gastroenterologist, the surgeon, and even the radiologist, they have a key role. And we actually conduct something called a multiple disciplinary team meeting, and where we discuss each patient and what is the best way forward for these patients. Because some patients might come very early, where we can do a surgical resection. Some may come a little bit advanced, where you might have to get a bit of chemo and radiation upfront, then surgery. And some patients, unfortunately, might present at a very late stage, where surgery may not have a primary role, but sometimes we may have to do palliative procedures.
With a diagnosis. And we'll come back to the palliative approach later,
Yeah.
but let's focus on the surgical approach. When patients come in, how do you know whether they're more suitable for surgery before or after chemo and radiation?
Right. So we do CAT scans to see if the tumor has left the colon and move on to other places. Two of the most common places that it can move to, it's the lung and also the liver. We do CAT scans of both the chest and the abdomen and pelvis to see how far this cancer has spread.
So, Dr. Singh, when you have patients and we refer them on to the surgeons,
Yeah.
you know, we just don't have a patient alone with a diagnosis of cancer. These patients might come with other comorbidities and stuff. But we have to help them manage their expectations, both medically and surgically.
Yeah.
You know, how as a surgeon would you go about helping these patients, you know, manage their expectations?
Yeah, so a lot of patients actually, I mean, they're above the age of 50, and they will come to us with comorbidities, as you said, such as diabetes, hypertension. Some may even have heart disease. The aim is not to get the patient to the operating table without optimizing them before, because some patients may have a tumor, but you might not be able to operate on them.
Right.
So we have to do what they call preoperative optimizations, where the patients will go to the cardiologist, get a cardiac clearance, and the anesthetist will see them preoperatively, making sure that they will be able to withstand an operation.
Right.
And then we proceed to an operation.
And we also in that setting you would want to figure out how much the patient knows, and see where they are in their own knowledge, maybe, and close any gaps that you think the patient might have about the
Correct.
diagnosis.
Yeah, so when a patient comes to me, I actually will ask them, what was told to them. And the word cancer to a patient, it's almost a death sentence. And you have to not only counsel this patient about the cancer itself, but also to manage in terms of what their expectations might be. Because many times they come and they would get a diagnosis of cancer. They don't know where the cancer is, what an operation they have to do, and the length of recovery. And these are the questions that they want answered. And it's amazing, actually, today, a lot of patients use Dr. Google.
Correct.
And they come to you, and I love to answer questions before, so I tell them, yes, go back to Dr. Google, whatever questions you have, and I start from the beginning, and we go all the way to the end.
Nice. Yeah.
How often do you see patients that could have curative surgery?
Oh, it's very common these days, especially patients who go for screening, or patients, they show up to the gastroenterologist very early after having symptoms, and the tumor is confined to the colon, and that's where I come in, really. That's where I have I'm most effective in terms of curing this cancer.
Okay. So when we come back after the break, we will be talking about how a patient is managed from a surgical perspective, and we'll talk about the different types of surgical approaches.
At Medical Associates Hospital, we offer minimally invasive laparoscopic cancer surgeries. This includes liver, gastric, colorectal, pancreatic, and gynecological surgeries. Let's fight cancer together. For further information, call us today, 462-2092. Medical Associates Hospital, #1 comprehensive and internationally accredited hospital in the Caribbean.
In medicine, we use many techniques to help effectively diagnose and treat your condition. One such technique is magnetic resonance imaging, commonly known as MRI. An MRI provides detailed images of the soft and bony structures inside your body, and as such, it can help diagnose certain health conditions and also rule out conditions such as tumors or growths. MRIs have other uses too. They can be used as treatment tools to help medical professionals locate injection sites or as a means for pre-surgical planning. Additionally, they can monitor the progress of a patient's treatment regime. MRIs can be most useful in helping to identify the following conditions: stroke, multiple sclerosis, spinal cord disorders, tumors, joint damage, bone infections, deep abscesses, severe muscular tears that require urgent treatment, and many more. An MRI can also be performed in addition to mammography for women with dense breast tissue or those that are at high risk of developing breast cancer. If you have an artificial joint, a pacemaker, or any type of metal in your body, you may not be a candidate for an MRI. Please contact your physician for further guidance on your eligibility.
Medical Associates Hospital is the only internationally accredited tertiary healthcare institution in the Caribbean for quality in medical care. Medical Associates' gold standard for quality medical treatment, culture of safety for patients and visitors, care based on leading, evidence-based best practices and compliance with international standards make us the leader in private hospital care in the Caribbean. Medical Associates Hospital, #1 healthcare for the entire family.
So welcome back, guys. We are now going to take it up a little notch. This discussion, we're going to go through the surgical methods that a patient might have to decide on for their surgery. So, Dr. Singh, I mean, we have the old school way of doing things, which is a open surgery. You'll make a cut on your belly. And we have some new ways that we do in surgery now. We have something called laparoscopic surgery, which is where we use some small incisions and we go in. But we also have some robots now.
Yes.
Yeah. So you walk us through how we do this thing now.
Okay, so I'll touch a bit on both, on all the different methods.
Mhm.
So traditionally, I mean, what we call open surgery, and a lot of patients will know about it. They must have had a family member or two who would have had or themselves had an operation. And long ago, you'll make an incision, which is a cut, and normally probably about 20 centimeters on the tummy if you're doing a colon cancer, and which is a pretty large cut.
Yeah,
It
it's a
leaves
big
a
cut.
very large scar,
Yeah.
which also prevents the patient from um, give the patient a lot of pain, prevent the patient from what you call ambulating early.
Yeah, getting out of bed
But
and walking
Yeah.
around.
as technology, progressed and we got into the computer age, they developed laparoscopic surgery. And what we do now, we make very small incisions. We make, 5 millimeter incisions and 10 millimeter incisions on the tummy, and we're able to do the same operation that we have done open laparoscopically. And these patients, they will be able to get up same afternoon and walk. They'll be able to go home quicker. They'll be able to get back to their family quicker, and they really, really love it.
Yeah. And you touch on the laparoscopic surgery there, and we had 5 ports, but we could even do it with 1 port, not so?
Yeah,
Yeah.
So, I actually learned that technique when I went to do my fellowship
Nice.
in 2009 in England, and they were actually introducing what they call single incision laparoscopic surgery, and where we use a single port through the abdomen, and normally it's through the navel area, the umbilicus,
Really was, yeah.
and at the end, the patient doesn't really have a scar.
Yeah, because it's buried down inside.
It's
the navel.
buried down into a natural scar.
So is that the scarless surgeries?
That's a scarlet surgery, yes. Yeah.
And how often have you performed it here?
I have done scarlet surgery since 2013. I actually did the first one in 2009 when I came back. Have done it for multiple different things, for colon cancer, appendicitis, gastric cancer, for bariatric surgeries. So
I think your women patients would be happy to know that they could get a little fix down inside the navel and
and it's
see those
amazing.
scars
I mean,
after.
they can actually play mass after.
Yeah, correct. Yeah, no
How
scars on the
soon
belly.
after can you play mass?
Well, it depends on the patient, actually.
But speaking of that, how quick, because I think
Yes.
one of the benefits of laparoscopic surgery is the reduced hospital stay and quicker healing time.
Yes.
So can you touch on how long somebody is expected to take to recover?
Right. So for we classify as a minor surgical procedure. Let's say you're doing a gallbladder surgery for gallstones. This patient can actually go home the same day. So you come in the morning, you get an operation, and you get home the same day. Let's compare that to what happened 30, 40 years ago. You get a large incision, about 15 centimeters in your tummy, and you stay in the hospital for almost 5 days.
Yeah.
With a cancer surgery, colon cancer, because this is major surgery, these patients can actually go home maybe in 2 days. However, for the safety of the patients, you may not want to send them home that early. So
Right.
maybe 3 to 5 days, depends on the patient.
Is that because you're looking at patients that have 2 parts of their bowel being joined together?
Correct.
So let's now touch on the complications that you find with laparoscopic cancer surgeries,
Yeah.
especially the colorectal ones. What are the common complications?
Right. So the Achilles heel of colon surgery, it's where you join. So when you remove a part of intestine, you have to join that back together.
Right.
And in joining this back together, the body has to heal, like any other incision. Now, there's a certain percentage of patients that will get leakage. And this is what you want to prevent. This is what you want to pick up if it happens very early. That is why you may want to keep the patient a little longer in the hospital. Make sure that everything is okay before you get them back to their families.
So we mentioned about patients might have a leak post-operatively. What happens if a leak happens and we miss it? What might be a problem there?
Oh, that's a big problem. That's basically a disaster.
Yeah.
If we miss a leak, the patient life might be at risk. Getting this patient back into the hospital, back onto the operating theater, and we have to deal with it. Patient may end up with a stoma at that time, but at that moment, the patient life is at risk.
How
So-
common that is?
It's not very common because what you have to do is you have to be very diligent post-operatively and really pay attention to different things that you do, different things such as blood tests, examine the patient, your vital signs, and there are signs and symptoms that you will pick up and might lead you down to further investigations. And if you pick it up very early, it's not a problem. What happens is that if it's picked up late, then the patient is in a real danger.
Some trouble. Yeah, man.
Okay, so what are the signs and symptoms of somebody with a leak?
Oh, so patient, they will get abdominal pain, severe abdominal pain. They might have fever. Those are the common things.
Okay.
Yeah.
And I think the vital signs will change at some
Oh,
point.
the vital sign will change. Patient becomes very, heart rate goes up, become tachycardic, the blood pressure drop, they become hypotensive,
Yeah,
and the temperature will
will change.
change.
Apart from just the leakage that
Yes.
could happen there, I mean, patients they could develop some other complications after surgery. Some of them might have some bleeding risks. Some patients might, have some risks with getting some clots in their legs. So,
Yes.
I mean, that also ties into the team management for these patients in
Correct.
hospital. But in terms of, surgeons managing these patients, where do you think there's any point that the surgeon stops saying, all right, I've gone into this case with this patient and I don't think there's much I could do here. You ever encountered something like that when you open the abdomen and you say, oh no?
Yeah. So sometimes, I mean, it's very uncommon in the modern era. If a patient comes in an emergency and you don't have scans, with the advent of the CT scan, that occurrence is a lot less. But there are some patients, even with the scan, you get in there and the tumor has now spread beyond what you can actually remove.
Right.
And in a case like that, you may want to do what they call a palliative procedure.
Right.
And a palliative procedure in a patient with colon cancer means you may have to bring out a permanent bag because now the cancer is not resectable.
Okay.
Yeah.
Let's touch on that back because it's a common question
Yeah.
for lots of patients. So can you explain a stoma bag or a colostomy so our patients could understand?
Yeah. Basically, what happens is that the large intestine is brought out onto the abdomen,
Right.
and the stool actually comes out of that and goes into a colostomy bag or a stoma bag, and that is collected through there. Now, not all patients get these bags. For straightforward colon cancer surgery, we join them back together. Now, there are certain groups of patients that will have definitely to have bags, some permanent and some temporarily. So the permanent ones, so patients with very low rectal cancers or patients with anal cancers, where there's no way to join. So there's only one place you can bring this out because you're looking to cure this cancer. You're not looking to do a halfway job.
Right.
All right, you don't want to leave back any cells inside this patient. So in terms of removing that part of the rectum, you may have to bring a permanent bag out. However, we touched on this earlier on, some patients may have to get chemo and radiation up front, especially for rectal cancers. And these patients now, they're very high risk for leakage when you join them back together. So we may bring out what they call a temporary stoma bag.
Right.
And that is removed in about 8 weeks' time.
Okay.
But safety of the patient is always on the surgeon's mind.
Right. So when we come back from the break, we'll be talking to you about other types of cancers and how we manage them surgically.
Medical Associate Hospital offers advanced laparoscopic cancer surgery, providing patients with minimally invasive options for cancer surgery. Our highly skilled surgical team utilizes advanced laparoscopic techniques and equipment to precisely target and remove cancerous tumors with smaller incision, which results in reduced pain, shorter hospital stays, and faster recovery times. This approach offers patients the benefits of both elective cancer treatment and improved post-operative comfort. We are committed to delivering comprehensive cancer care with the latest medical advancements and technology, ensuring the best possible outcomes for our patients. Your health and well-being are our top priorities. We are here to provide you with the most advanced practices with compassionate care.
Medical Associates Hospital is the only internationally accredited tertiary healthcare institution in the Caribbean for quality in medical care. Medical Associates' gold standard for quality medical treatment, culture of safety for patients and visitors, care based on leading, evidence-based best practices and compliance with international standards make us the leader in private hospital care in the Caribbean. Medical Associates Hospital, #1 healthcare for the entire family. At Medical Associates Hospital, we offer minimally invasive laparoscopic cancer surgeries. This includes liver, gastric, colorectal, pancreatic, and gynecological surgeries. Let's fight cancer together. For further information, call us today, 462-2092. Medical Associates Hospital, #1 comprehensive and internationally accredited hospital in the Caribbean.
All right, so welcome back, guys. So Dr. Singh, we're gonna just go through briefly what might be some other types of cancers along the gastrointestinal tract that a surgeon might encounter.
Yeah, so you can start from all the way into what you call your food pipe.
Mhm.
That's the esophagus.
Mhm.
So there are cancers that can happen there, and also cancers in the what we call the stomach.
All right.
All right, so that's gastric cancer, the small intestinal cancer, and we touched earlier on colon and rectal cancers.
Right.
There are also some solid organ cancers, such as the pancreas.
Mhm.
It's a very, very topical thing. The patient
Correct.
here, pancreatic cancer,
Yeah.
they get a bit scared, but
Yeah.
even pancreatic cancer, we can do laparoscopically.
Oh, sure. Because most times patients with pancreatic cancer, we'll pick it up too late or very late.
Yeah.
But from a surgical perspective, if you have to deal with pancreatic cancer, you could do that laparoscopically.
Yes,
Yeah.
actually we have done laparoscopic both the distal pancreatectomies and also the Whipple's operations.
Yeah.
One of my most difficult and complex cases that I've done was a laparoscopic Whipple's, and that's where this is a very complex operation. It took us almost 10 hours, and this is where you have to remove the pancreatic cancer, and also you have to do different joinings, and you don't do one. You actually do 3 different joinings to get this patient back together. This patient actually did amazingly well. She was up out of the ICU in 1 day, left the hospital in 5 days, which actually was very, very amazing.
Yeah, Whipple's is a big procedure.
Yeah, it's not actually commonly done. Presently in the Caribbean, we have actually done the most number, and recently,
I had quite a few recently.
we're actually leading in the Caribbean with that.
Oh,
We're
nice.
the leading.
We're the leading.
Oh,
Caribbean.
I'm very happy to hear that. Dr. Singh, what are the latest advancements in surgery?
Right. So, in the latest advancement, you will have to really talk about the robot,
Right.
and and they actually have robots that maybe in the future operate on their own, and that's futuristic.
Yeah,
That's what
scary.
you'll see on Star Trek and stuff. But however, these days the robots that we have, they're still the master slave robots. So
Right.
the surgeon is not in the operating theater. He's in a room next door, but he is in control of the robot. And the robot is just another way for us to do minimally invasive surgery. There are some things laparoscopically can be done, but with the robot, it makes it a lot easier.
Tell us about what your approach is with robotics at Medical Associates.
Right. So we actually we did colorectal surgery using the freehand robot. Now the freehand robot, it's a robot where you can actually control the camera. One of the problems in doing laparoscopic surgery is having a very good camera holder, someone who assists you, and
Right.
they actually have to know what you're thinking without you telling them. Now, what the freehand robot does, they give the control back to the operator.
Right.
So I am in control of the camera, and wherever I look, the camera will look. So we have used it actually to perform colon cancer surgery.
Right. So this is interesting because the person that's assisting you
Yes,
has to basically read your mind.
correct.
How are they doing that?
Well, with a lot of practice.
Yeah, in medical school, we learned that, you know, you used to get a little cussing thing when you
Yeah.
We don't really do that these days.
We have evolved, Christopher.
nice. Yeah.
Tell me something. What is the prognosis for these patients that have late presentation and have surgery?
Okay, so prognosis actually is dependent on stage of the cancer. So early stage cancers, they have the best prognosis. I mean, you may cure these patients. So patients with stage 1, stage 2, they have 80-90% survival. However, as the stage increases to stage 3 and stage 4, the survival decreases. Now, this is where our good friends, the oncologists, come in.
Right.
And they can use different types of treatment, such as chemotherapy, sometimes radiation, and they might be able to extend this patient's life.
Okay.
Because reality check, not all patients will survive it.
Correct.
Right? So we must bring in that part of end of life care for patients. As a GP doctor, and coming up, that's form part of the bulk of patients in the elderly group that we would see.
Yeah.
So I mean, is there anything that a surgeon could do as a palliative procedure? I know you mentioned the palliative version of the stomas. Any other things that they could do to help relieve, discomfort, pain, these kinds of things for patients with cancer?
Well, sometimes, you can actually do a palliative. For instance, a patient might come in with a blockage, an obstruction. You might be able to remove the tumor.
Right.
Patient might have bleeding. You might be able to remove the tumor also. And as you said, sometimes you may have to bring out a stoma bag. Also, sometimes you might be able to administer certain types of pain medication, and you could do that laparoscopically. But in the modern era, actually, it's done more radiologically.
Yeah.
Yeah.
Interventional radiologists.
Interventional radiologists.
Yeah.
A minimalistic approach.
A very minimalistic approach.
Dr. Singh, we really appreciate the insight you've given to us today from the surgical side of managing these kinds of cases. I think the viewers will be really happy to hear how simply you brought this and you broke it down for us. It's good to know that patients have options, that they could plan their surgeries with their doctors, and it's not that we just pushing what they have to do onto them.
It has been a pleasure to share this information with you guys.
Thank you very much.
Thank you.
And we may be calling you back sometime in the future for more information, because you have everything up there. We just need you to share it.
Anytime.
Thank you so much.
Yeah, thank you all for viewing, and we look forward to seeing you and for you all to join us on our next episode of Medical Associates Health Check.
Feel free to contact us on our social media pages if you have any questions or queries, or if there's any burning issues that you want us to touch on. We'd be happy to hear from you at any time.
Medical Associates Hospital is the only internationally accredited tertiary healthcare institution in the Caribbean for quality in medical care. Medical Associates' gold standard for quality medical treatment, culture of safety for patients and visitors, care based on leading, evidence-based best practices and compliance with international standards make us the leader in private hospital care in the Caribbean. Medical Associates Hospital, #1 healthcare for the entire family. At Medical Associates Hospital, we offer minimally invasive laparoscopic cancer surgeries. This includes liver, gastric, colorectal, pancreatic, and gynecological surgeries. Let's fight cancer together. For further information, call us today, 462-2092. Medical Associates Hospital, #1 comprehensive and internationally accredited hospital in the Caribbean.